Hi everyone, welcome to Mindful Monday. Hope you all had a fantastic week and that you are still coping. Probably 70% of all children who get referred to me for therapy and assessment get referred for ADHD. And after a full assessment is being done with them, only about 30% of these children actually show symptoms of ADHD. And only approximately 5% of these children actually need to be treated with medication for this condition. I think there is so many stigmas and myths surrounding ADHD that I was so thankful when I received the question for this week's discussion. So the question is, I think my child has ADHD. How can I be sure about this? So again, like I have also previously said on this channel, I am not a clinical psychologist, and that is important to take note. I'm a social worker working in the mental health sector, and I also conduct assessment and therapy with children. I think the most important thing that we need to understand about ADHD is that it consists of two important parts. First of all, the attention deficiency part. Now, this is the part that goes with the inability to concentrate, the short attention span, the forgetfulness, the absent-mindedness, and then there is the hyperactivity part. Now, this is the fidgeting, the hyperactivity, the impulsivity, the irritability, and only once you put these two parts together, you get the whole list of symptoms that contribute to a low self-esteem, troubled relationships, and difficulty at school. So in the event that your child only struggles with concentration or that your child is only hyperactive, then an ADHD diagnosis cannot be made. Both parts have to be present for a certain amount of time in order for an accurate screening to be done and for such a diagnosis to be made at the end of the day. It should also be noted that ADHD, just like any other condition, can be treated in a variety of ways. Although it is very true that medication is an effective way to treat this, and medication is effective in children who suffer from severe ADHD. Parents should also take note that ADHD medication can have certain challenges too. Therefore, when discussing treatment options, all options should be considered, and the best option for the specific child should also be chosen. So in order to be sure about ADHD, if you suspect that that can maybe be the case for your child, it is always best to take your child to a professional who conducts ADHD screenings. So the screenings is a very thorough process. The professional will consult with your child and do in-consultation screenings, and they will also give you questionnaires to complete. Questionnaires should also be given to the school your child is attending, and the school will also then complete it and give all of that back to the professional who is completing the screening. Anyone who claims to complete a thorough ADHD screening in one consultation, in my opinion, do not have a clue what they are doing. So please subscribe to my channel, follow my page on Facebook, and we will also be exploring this topic a bit more detailed during this coming week. Have a good week.